Hey, transformational prevention again. Oh my. I know you love me, that's so comforting. Won't choose, you want me, take my hand and know me better. I know you love me, that's so comforting. Won't choose, you want me, take my hand and know me better. I know you love me, that's so comforting. But we are stuck except you take my hand and know me better. Hey, know me better, love me better. Hey, take me better, love me better. It's the transformational parenting show with Mute Olori.
Hello, everyone. Welcome to another edition of the program Transformational Parenting Show. My name is Mute Olori, your parenting coach. And for some time now, we've been running a series on special needs children. We've been able to identify some of the causes, and of course, we've profiled some form of support intervention for parents who are parenting children with special needs, and of course the children living with one or the other of those special needs. Today on the program, we are going to be looking at the health and well-being of special needs children. As parents and caregivers, ensuring that the physical, emotional, and mental needs of these children, these amazing and remarkable children, has become an issue that is paramount to every one of us or every one of them. So today we're going to be looking at the health and well-being of both the child and of course the caregiver or the parents. Please don't go away. When I return, you will be meeting my guests. Welcome once again to the Transformational Parenting Show with Mute Olori.
It's the transformational parenting show with Mute Olori.
All right, welcome back. It's the Transformational Parenting Show, and today our focus is on the health and well-being of parents and caregivers on children who are living with one or the other special needs. Remember, we're running a series on special needs children, and to shed light on this important subject is the founder of Heaven Homes Foundation, a support community for parents of special needs children. She's a mother of 2 special needs children and of course over 500 other children, underprivileged, underserved children who are under her care in Nigeria, Cameroon, and Burkina Faso. She's very passionate about support for such children and of course a functioning health sector for them. So my guest today is no other person than Fatima Zara Ahmed. Thank you for joining us today.
Thank you for having me.
Zara Unscripted.
Thank you
Thank
for
you.
having me.
Why are you so passionate about advocating for children with special needs?
Well, I think for me, I'm coming from a place of pain to purpose, right? I have 2 of my own. I know the challenges, especially in a country where you don't get much resources for these children. And then on the other side of the country, we have families that cannot afford the health care. And I think that was where I started having this passion to, go all out and support these families. Because sometimes we take a lot of things for granted. You just walk into a supermarket, you buy a box of cereal, you get your child diaper. There are children that the parents cannot afford the cereal. There are children that the parents cannot even afford diapers. We have met a lot of children that have severe bed sores because they are left neglected. There are no diapers. They tie rags for them, and then it gets infected. So these are the kind of communities we have the passion to support because they don't have access to all of these things because to some of them it's more or less like luxury. Yeah.
So that's why this passion to see that you help others.
These children have equal rights.
Because there are a lot of people that have this, they have not been able to deal with that.
Yes.
And here you are with 2 children, and you also find time to look at this. So what are some of the common health challenges that children with special needs face?
Common health challenges, depending on the special needs the child has, can vary actually. So if you're talking of a child that may have Down syndrome, for instance, Down syndrome can come with other, it can come in pairs with other conditions. For my daughter, she has Down syndrome, and also she's on the autism spectrum, and also has a heart condition, because sometimes Down syndrome comes with heart conditions. It could be mild, it could be severe. For other children that have, let's say, autism, there are children that have autism and also have attention deficit hyperactivity disorder, which is ADHD.
Yeah.
So there are other complications. And then I realized that there's a gap in the society. These families do not have access to healthcare. And this is where we come in to, bridge. We're like bridge builders. We actually fill in the gap for them. We bring them, like I said, I have kids from Cameroon and Burkina Faso that I brought to Nigeria to access healthcare. So it's not just a one country issue, it's more or less like an African kind of issue, accessing healthcare for these children.
Yeah, I think probably part of what is our problem is the connotation, the religious, spiritual connotation
aspect of it, yes, the misconceptions that comes with having these children. Yes.
And so you find there was a time we killed twins, now we still have situation where albinos are not safe,
yes,
in a society, and I think in Africa. So I could really relate with what you're trying to say, but let's look at it, because you're managing a condition, and then you're also looking at the emotional stability of development of this same child. So how can we ensuring that we have a holistic wellness plan or in place or for these children?
I think if you have a special needs child, the most important thing you need to look at for the diagnosis is not just the physical aspect. Mental and emotional aspect is most important. Why? Because if you do not take care of their mental and emotional state of mind, you would have children coming with depression. We have children with anxiety issues. We have children that are extremely violent towards even the parents. So these are things you need to look at. We're not just looking at the physical. Everybody is an advocate now for mental health. Why is it important? Because your mental health is the complete well-being of a human being. So also it goes to children with special needs. You just don't neglect one and, just rely on, okay, because he has cerebral palsy, we need to go for physical therapy. No. After physical therapy, what next? You need to work with mental health doctors for your child, because there are things that your children might be going through, because like I said, they have feelings. We tend to overlook their feelings, but they do have feelings, and their feelings are valid. And most of them, like when they hit adolescence, because there are a lot of hormones that are haywire, they don't even know how to manage these emotions. So if as a parent, you don't even know how to help your child to manage these emotions, you have to seek professional help for that, because there are mental health doctors that will help you plan how to navigate, how to take care of these children, maybe by having a routine at home, because I know a lot of children do have routines. What time does he wake up in the morning? Because sometimes for children that do not work on routine, they have issues with anxiety and panic attacks because they don't know what to expect. They don't know what's going to happen in the next minute. So you have to work with professionals to help put you along the way so you can have this routine and structure. Your children need to have structure, a stable structure in their life. They need stability. So, and the stability we're talking about goes hand in hand with their mental health and the emotions of the children.
Because that's what I wanted to ask you. What kind of stability are you talking about? I've seen where a lot of children are aggressive. I thought it was actually the symptoms of the illness. So it could be a fallout of lack of...
Yes, because some of them feel misunderstood actually. And then when we talk of children that are non-verbal, those that cannot speak, those that cannot communicate, it's frustrating. Imagine when you're sick and then you don't know how to say it or what you're feeling. It's not easy. You have to find a way to communicate. But then these children, some of them, they don't even know how to communicate to the parents. So it gets frustrating, and these can lead to, depression. And depression has devastating effect on these children.
So what kind of stability are you saying we should create? How do we create those structures? How do we create those stability? Do you have like a timetable?
Having a routine. Most children do have timetable, actually. Time management, managing the time. You wake up, let's say at 8 a.m. My son takes his medications by 9 a.m. It's a routine. Every day he takes his medication at 9 a.m. and 9 a.m., 9 p.m. because he's on medication twice in a day. That is a routine. And then you feed at 10, for instance. He takes his bath maybe 8:30 a.m. This is what we call routine. So once you structure that, okay, at 8:30 my son is going to take his bath, at 9 he's going to take his medication and breakfast, and then there's a nap time. Maybe let's say 11 to 1 p.m. he's taking a nap. And then if it's a child that can do activities like painting, coloring, or other activities, there are so many educational board games you can engage the children with. There are, what do you call this? Lego. They can play Lego. You structure the time. You have a time plan for your child. And so the child will be looking forward because he knows, oh, once it's 11, it's time for me to take my nap. And automatically, because the system is used to that timetable, the child would find his or her way to the bed, sleeping to take a nap. So this is the routine, and that routine gives them stability because they know what to expect. Yeah, so it makes it more comfortable and easier for all of us.
Yeah, to avoid those panic attacks, anxieties that will come in.
Yes.
Now, Fatima, what you just mentioned is a system where someone knows what to do, and it sounds like a privileged structured system.
Yes.
You work with the underprivileged and underserved children.
Yes.
How can those kind of environment provide stability and structure for the children?
Sadly for these families, most of them, there's no stability. Because when you have a family that can barely feed everything, the world has crumbled on them actually. So they don't have that stability. But how we come in as an NGO is we try to empower so they can be able to be a little bit financially independent. Now, if you have a family that is financially independent and that can feed at least twice in a day, they can have some form of stability. They will have time for these children. They will be able to know, okay, at this time, because I already have food at home, my child would eat at so time. That is a little bit of stability in their own way. But it's not going to be the same as some of us that we are privileged like that.
Okay,
it's
so
not the
but
same.
let's look at the timing. Is there a way that they can at least have certain level of structure for these children? I mean, access to medication, access to healthcare. How do they do it? Are they already systems in place that could help those people?
Systems in place, I do not know about that, but for me, what I do is we pay ahead of time for most of these families. I can pay for a child's physiotherapy for 6 months. I can buy his drugs for a month or 2 months. At least the parents know the child has these medications for 2 months, so they're just going to concentrate on other things for the child. And then also we have taught a lot of these mothers how to make local cereal at home, so they don't have to, we have these grains, we grow them. We have all this millet, sorghum, we have maize. These are things you can combine and make a very healthy cereal for your child at home. So this in itself, it's a little bit of stability for most of these families, yeah.
So that they'll be able to navigate
Yes.
The healthcare system,
Exactly,
at least when
yes.
it comes to nutrition and maybe some medication.
Medications.
But that is the most difficult area for these children to have access to proper healthcare.
Yeah.
All right. What resources do you think, how do you think communities can come in to support the children and, of course, caregivers or parents that, need to provide for this well-being for the children?
I think how the community can come in is helping us advocate, because I think there's lack of awareness. There's a serious lack of awareness on these conditions that our children have. So sometimes it's even difficult. Like, that's why a lot of these parents hide the children at home, because even let's take a local setup, a neighborhood, you bring out your child and everybody is, looking at the child with one kind of look at what is this? Why are you bringing this child out? So we need more of advocacy first, because when people are aware, they will be empathetic, and then there's going to be that acceptance. So we need the community to help advocate and accept these children, and then the help can come in. Because without advocacy and acceptance, the children will not be included in the society.
So how can parents collaborate with sectors like schools or educators, administrators, to see that there's a proper condition? Because the same thing you mentioned at home, if they are in school, we should also be able to have those structures. Then what can we do? Because you have diverse kind of children coming to that space. I know that at times also some of them are violent.
Yes.
You know, in behavior. So how can we collaborate with the sectors to see that there's a proper sense of health, you know, and security provided for these children when they're out of the home?
Okay, now I'm going to speak for inclusive schools, because not all schools actually accept these children in their systems. But for inclusive schools, I have seen that they're doing an amazing thing. They're doing amazingly well with these children.
Fantastic.
Now, for the school my daughter goes to, they work hand in hand with another private consultancy firm who offer the services of providing SEN, that's special educational needs teachers for a child. So when you have a child in an inclusive school, because the child might not behave the same way as a neurotypical child, he will need what we call a shadow teacher. So he would have a shadow. And this shadow is a person that goes everywhere with the child in the school. So if your child is going to go off the step, the shadow is there to help support the child, you know, show him, oh, this is dangerous. No, don't go there. It's going to hurt you. This is going to hurt you. So these are schools that have gone far, you know, in including these professionals to help with a child going through school. But for other schools, I really don't know. Maybe we have to reach out to them and then maybe start advocating.
How important is it to have those structures in those schools?
It's very, because you cannot have, for instance, you cannot have a child that is on the severe spectrum of autism in a school that is not inclusive, because that child might end up not even hurting himself but hurting others, because some of these children can be extremely violent. Now, a SENT, special education needs teacher, is a professional that can tailor individualized educational plan towards the needs of that particular child. So if the child is extremely violent, that means that child would be seen by a behavioral therapist. So inclusive schools have all these professionals with them: behavioral therapists, speech therapists, occupational therapists, and then the SENT, that's the SENT teacher. So, but when you have just a basic school that does not have this, they cannot cater to such children.
So parents should really look out for schools if they must include the children into
you have to get a school that is inclusive and that have all these professionals at hand that can help your child. Yes.
Okay. The caregiver, you know, there's an adage in my place, you know, when they say the person who takes care of, let me put it like a mother who gives birth, you know, should also be taken care of.
Yes.
I'll take a short break. When I come back, I want to know, how do you care for yourself? How do you ensure that you are in a mental, emotional, physical, stable place to be able to take care of someone who needs physical, emotional, and mental stability? I'll take a short break. When I come back, the conversation continues. Please don't go anywhere.
It's the transformation of parenting show with Mute Olori.
All right, welcome back. It's still the Transformational Parenting Show, and we've been doing a series on special needs children, caring for them, and we've looked at some of the spectrums that they belong and the causes and effect on family and, of course, on the children. Today, we are looking at health and well-being of not only the special need child, but also the caregiver, and that's the parents. And my guest has been really helpful in, you know, diving into these issues and being very honest, because she is also a mother that has 2 special needs children and also caring for over 500 underprivileged children that in Nigeria, Cameroon, and Burkina Faso that are faced with these issues. So some of us are so relaxed because, oh, the people we know and we see around us can take care of theirs. But there are lots of people out there that cannot take care of these children. They are frustrated, they are tired, they don't know what to do. How can they begin to care for themselves? Because like I said, you are an advocate. You've got to that point where you can speak about it. You are in a very stable sense of health. You know, you're courageous to speak about it. You seem to be relaxed, you know, and talking about it. But I know you didn't start from here. A lot of people are going through mental issues, psychological issues, just for the fact that they have these children. How do you care for yourself?
Before we talk about caring for myself, you have to understand that you need to accept first. Acceptance plays a vital role. A lot of these parents are still in denial that your child has this condition. It is there. It's imminent. The child has the condition. Accept it. It is something that you don't have control over, so don't wallow in the pain and stop the self-pity, the self-blame, because these are things that will keep holding you back. I was in a point where I kept on saying, what if I didn't go to that hospital in Kano? What if, you know, those what ifs will keep on being in your head until the day you learn to erase them completely. Stop blaming yourself. It's not your fault. And you did not do anything wrong. You gave birth to a child that God chose you to have this special child. So take it as a blessing. It's not a curse. It's not a burden. It's not a liability. So once you start thinking, it's a mindset shift. Actually, you need to completely shift your mindset. Be positive. See the positive in the child. Then you start working on yourself. Love yourself. Regardless. Yes, you have the child. So love yourself. Learn to love yourself and stop blaming yourself. You didn't do anything wrong. It's not something you did that God decided to punish you. No. Then for self-care, for the caregiver, you cannot pour from an empty cup. You need to be full to be able to give. You need to have to be able to give. If you don't have, you will not give. Never. If you're not mentally stable, emotionally stable, you cannot take care of these children because caregiving is demanding. It takes a lot to be a caregiver. So first things first, check on yourself. Seek help when you have to. If you feel you're not okay, it is okay. Seek help. There's nothing bad in seeking help. You have professionals out there that can help you. You know, family, friends. You can take turns taking care of the child. When it becomes overwhelming, you can ask a sister or a friend, please, can I bring over my child so I can have like an hour's sleep? Because sometimes we don't even sleep. We can go 5 days without sleeping when a child is having it, when he's having it bad. So you need to sleep. Create time for yourself. I do my me time, actually. I love sleeping. So I have my time. There's what I call my me time. That my me time, I sleep, I rest, wake up, take a cup of tea, and then watch Netflix, uninterrupted. And the kids are with their nannies. Learn to delegate. If you don't have the means to hire a domestic staff that you can train to take care of these children, like I said, seek help from friends and family. Definitely there would be someone out there that would be willing to take the child for an hour or 2 hours so you can have that rest. There are centers that can gladly take in your children. You know, there are schools that do after school hours. You can pay if you're buoyant enough. You can pay and then go back home and take time off. You know, most importantly, spousal support. If you do not have support from your spouse, it is difficult to navigate the journey. And I think part of my strength is actually my husband. Yeah, because anywhere I go, I speak about my husband. He has been there from the very beginning, and we're still here, you know. So that strength that he gives me drives me, actually. So
what are the consequences of not caring for yourself?
It's devastating.
Because it's easy to play superhero.
Yeah. And there's nothing like being a superhero. You can only be a superhero when you're mentally okay. Now, the consequences of not taking care of yourself is you might get into depression. And once you slip into depression, there's no going back, actually. Even if you come out of it, you will never be whole the way you were before. So, and I think parents should equally learn to pick up signs of a depression coming in. Because once you feel you're tired, you keep on saying, I'm tired of this child, I'm tired of this child. It is time for you to seek help. It means there's something going on. Because I have met a mom that stopped taking her bath. You know, she stopped socializing, she was isolating. And I had to tell her that you need help. Because it's not normal for you to say you want to stay indoors 7 days in a week, you're not taking your bath. These are early signs of depression. So once you feel you're coming down with something, talk to someone, seek professional help. Yeah.
Like I said, you need to be in a stable place
Yes.
to be able to help your children stabilize.
Yeah.
You know, thank you. I don't want to say, don't sound like you, don't be a wicked person, don't be a clog in someone's wheel of progress. I don't want to sound like that, but I think they all need your help. They may not be saying it. They may not be asking because they don't want to inconvenience you. But why don't you be that person that would just go straight to someone you know is going through this and say, can I help? And that means you also need to study to read about how to care for people that are down with any special needs. Be that support structure, be that support system that they need, be that help that will make mother and child or parents and children going through these things find stability, have a structure, and of course, make sure that their well-being and their health is secure and in place. That is it for the Transformational Parenting Show for today. Next week is another edition, another topic, but just know that everything we do is to give you the support as a family and, of course, as a society at large. My name is Mute Olori. I'll see you next week. Remember to follow us on our social media platform. And if you have any question, please feel free to reach out to us and we will connect you with Fatima Zara Ahmed. And you can actually look her up on Instagram as Zara Unscripted. See you next week. Bye-bye.
Hey, transformational prevention again. Oh my. Hey. I know you love me. That's so comforting. Won't choose you want me. Take my hand and know me better. I know you love me. That's so comforting. Won't choose you want me. Take my hand and know me better. I know you love me, that's so comforting. But we are stuck except you take my hand and know me better. Hey, know me better, love me better. Hey, take me better, love me better. It's the Transformational Parenting Show with Mute Olori.